Well, the continuing battle over health care goes on, and today some breakthroughs in the House. They're saying they won't be voting before the August recess, but they will be voting in September. That gives a whole month for the members to read this 1,000-page plus bill. And that's been a big hang-up that they have these very complicated, huge program, $1 trillion, $1.5 trillion. We can't read it. So that's been put off. And but it looks like the Blue Dog Democrats, the so-called conservative Democrats, have made some breakthroughs there, and they've granted in some things having to do with cost and small business mandates. What do you think about that?
I think you buried the lead. I think the most important thing that happened was that the Blue Dog Democrats have agreed to a compromise that may clear the way, and probably will clear the way, for the House to pass a health bill as early as September that will keep the president's top legislative priority alive. And there were fairly significant giveaways to the Blue Dogs so that businesses will not have to mandate that or will not be required to offer health insurance to their employees, and other changes to help rural Americans. But nonetheless, I think this is a very big success, a big victory for President Obama.
Yeah, well, the question is how many Blue Dogs are going to follow. Congressman Mike Ross of Arkansas, the Blue Dog leader who's been negotiating this. As you know, they come from a lot of conservative districts. They won marginally. Some of those districts were held by the Republicans. So, it depends how many of the 52 are going to fall in step. There's still the month of August where you're going to have a tsunami wave of attacks on this plan and ads defending it. So far, those ads and that offensive have chipped away at the support for this plan, under 50%, and Obama's support has been falling as the economy gets weaker.
Yeah, I at this moment, for a new president, I wouldn't bet against him. I think with this, there will be enough votes in the House, at least, to pass health reform. Whether that means that we'll move things in the Senate, that's another question, and probably a question for another day.
Yes.